I'm Justin Ledesma. I'm an orthopedic spine surgeon here at Plano Orthopedic. I grew up in Tucson, Arizona. Was a Wildcat ever since I was a little guy. Went to all the football games with my dad since I was like 5 years old, and eventually went to college at the University of Arizona. After college, I went to medical school at UCSF, which is in San Francisco. I then went down south the peninsula a little bit to Stanford, where I completed my orthopedic surgery residency. And after that, did a fellowship down the coast a little further in San Diego, in La Jolla, and that's where I got my specialized training in spine surgery before starting my career in practice. I grew up around doctors. My dad is a doctor. He is an OBGYN. He actually still practices in Tucson. And so I was always exposed to hospitals and kind of that call and doctor's life and pagers going off. He would bribe me with donuts to go around with him on the weekends and hanging out at the nursing stations and all that kind of stuff. I would always run into patients that he knew. So, being exposed to that kind of opened my eyes to what it's like to be a physician and have an impact on a lot of people's lives. And so I always was interested in it from that perspective. And then, with schooling, I was really into science and was a physiology major in college. And all that put together just kind of made sense to go into medicine. Once in medical school, the reason I really liked orthopedics was the fact that you have very clear results with a lot of folks. You're not treating a lot of chronic conditions. You have people who have problems and you're able to fix those problems and get them back to doing things that they like to do or want to do. And within orthopedics, there's a lot of different options too. I chose to go into spine because it's more complex, it's more nuanced in a way, and there's also quite a breadth of what we can do, whether it's through an endoscopic surgery through a 10 millimeter incision or scoliosis surgery correcting big deformities through a much larger operation. Having that variability and variety was enticing to me, in addition to the technology that has come about over the years. Nowadays, people feel really rushed when they go to see a doctor and don't feel like they get heard and listened to and really understand exactly all the aspects that are involved and for whatever reason they're there. So I tend to spend a lot of time with my patients because I want to understand full history of what they're going through. Surgery is not something that I take lightly in discussing with patients, and I really try to focus on less is more. Not everybody is a candidate for minimally invasive surgery, but when looking at potential patients who may need surgery, that's always on the forefront of my mind. What is the minimal amount that we can do for this patient to get them feeling better and get a good outcome? Because ultimately, what we want to do is have quick resolution of pain and getting people back to the activities that they enjoy as fast as possible.